6 years ago, in a hot, scanty classroom, a professor of surgery was telling us of the biggest mistake he had ever made as a surgeon in his career. He told us he had a 41-year-old woman who had a lipoma on her thigh, and it was supposed to be a simple procedure. They prepped her for the surgery, took her to the OR, and then they started the operation. In the process of excising the lipoma, Prof did not know that the femoral artery had a tortuous course in the lipoma, and in the process of excising the lipoma, he nicked and transected the femoral artery 3 times. He got scared, he panicked. He broke his scrub, called a more senior fellow, a professor of surgery, and got help. The other prof got into the OR with him, and then they helped him. He reconstructed, he reanastomosed the artery, excised the lipoma successfully. A case that was supposed to take 2.5 hours ended up lasting for 11 hours. When he was about to take his sigh of relief, and then they took off the tourniquet, the patient immediately arrested on the table and died. The patient died of hyperkalemia because of the prolonged tourniquet time. In that classroom, the effect of hyperkalemia on the heart was burned into my memory. The unforgettable lectures we have in medical school sometimes is when our teachers tell us about their most painful or most dangerous experience in their practice. And that is the reason why I'm doing this review. Complications was written by Professor Atul Gawande. Professor Atul Gawande is an Indian American endocrine and general surgeon working in the United States, and he's a very famous surgeon. He's one of the most influential surgeons currently today, and he's a Rhodes scholar, and if that's not a big deal enough, he's also a MacArthur fellow. And you see, let me push the point home. MacArthur fellowship is known as the Genius Grant, and most MacArthur fellows end up winning Nobel Prize, becoming head of state, and so it's a big deal. Complication, as the name suggests, is a surgeon's note on an imperfect science. Complication is about 300 pages long. It has a rating of 4.2 on Goodreads, so it's actually a good read. It's a medical memoir of his experience as a surgeon, both in training and even when he became a fellow. While talking about fallibility, he talked about when he was a registrar and he had a patient he had to intubate and he couldn't get it. It was an emergency, it was a serious situation, but he just somehow could not get the endotracheal tube into the patient. The patient ended up with laryngeal edema, which makes it even harder. It was a busy day and his senior registrar had to attend to another case, so he could not get help at that moment. Eventually, the senior registrar came and had to pass a pediatric size endotracheal tube, and eventually the patient was fine. But it brings to bear the fact that doctors are actually fallible. Eventually, the case was reported at morbidity and mortality and all that, but he saved his patient in the long run. While talking about medical ethics, Professor Gawandi talked about the dilemma of giving patients optimal care and, on the other hand, teaching doctors. Now, if you want to give patients optimal care, that means they have to be treated by the most qualified surgeon at all, and that makes sense in itself. But you also have to balance with the fact that you have to also train younger surgeons, because eventually the older surgeons will retire and they will die, and they will die without skill. So you have to also balance the fact that you want to give patients optimal care by the most qualified surgeon with the fact that you also have to train younger doctors. And that is actually a conflict that he really went into when he was talking about medical ethics. Then he also talked about mysteries. He had a 28-year-old female who came with swelling and reddening of the lower limb, and on the surface, it could have just been cellulitis, a subcutaneous tissue infection that needed antibiotics and the patient to be discharged home. But it could also be necrotizing fasciitis, which would require amputation. He talked about medical mystery he had seen in his practice, and it was actually an interesting and captivating story. The most captivating story, however, for me, was when he was talking about when good doctors go bad. Now, most medics come into medicine hoping to be good doctors, to save lives, to make a difference in the world and in the life of people. As one of my classmates said, he said he wanted to be a doctor so he will make thanksgiving to God a reflex in the relative of his patients. So everybody comes with that, idea. We want to be like Dr. Wilson in House MD, or, Dr. Melendez in The Good Doctor and things like that. But sometimes good doctors go bad. And when they talk about, bad doctors on media, on social media, on things like that, we usually hear about the most terrible people who are quacks. Some of them are not qualified, who do, heinous things to patients. But sometimes even sterling doctors with awesome bedside manners and great skill and patient care sometimes can go bad. If you read the Harry Potter series by J.K. Rowling, then you remember when Hagrid took Harry to Diagon Alley when he was supposed to get his first wand. and they got talking about Voldemort and how, a wizard has the path to become, and how a wizard can be as bad as Voldemort. That is the kind of story in How Doctors Go Bad. When Good Doctors Go Bad is a chapter from the book Complication, and is a story about an orthopedic surgeon, Dr. Howard Goodman. Dr. Howard Goodman was 42 years old. He was a fellow, he was a surgeon, and he was an excellent surgeon. When he was employed into his teaching hospital, he revolutionized the orthopedic department. He had some older doctors, some archaic surgeons in the department. But when he came, this dynamic guy was outstanding. He brought in new knowledge, he brought in new energy, he brought in new skill into the department. He was outstanding in every respect. He had great bedside manners. His patients were having good results after surgeries. He was modern, he was hardworking, he was kind. These are the kind of doctors, when you call and they are not on call, they come to the hospital and then they fix what they are supposed to fix. At a point, he had a pediatric patient who had bimalleolar fracture. He was not on call, but he came nonetheless, went out his way, fixed the leg of the child and went back home. So he was outstanding like that. Soon he became known as the #1 booker by the operating nurses and the theater staff. And eventually that earned him the nickname the producer. And the producer was going on and on. See, this guy was so good. The medical students in the teaching hospital actually gave him a teaching award. If medical students are giving you an award, there are two things involved. Either you are an excellent teacher or you are a doormat. And this guy was not a doormat. So he was really a brilliant guy. And he was getting busy, and that became the origin of the problem. He was so busy that he doubled his annual income and then he tripled his annual income. But that tenacity and enterprise comes at the detriment of finesse and patient care. And not long after, other doctors began to notice mistakes in his decisions. They began to see inconsistencies in some unnecessary procedures were being done, and it was getting severe. It was getting more serious, such that senior registrars had to begin to scrub into, cross-check his opinions, second guess him, and things like that. And eventually, his cases began to be, the big deal in the mobility and mortality review. It was so serious that Dr. Goodman stopped attending the mobility and mortality review altogether. This was the point where the elder soldiers began to take him to the corners and then begin to ask him if he had any personal problems, if there was anything wrong. And in this encounter, he sounded remorseful, even sorry for the mistakes he had made. And he made resolves that he would be a better surgeon, but to no avail. And consistently, his cases were getting worse and worse. When nurses and paramedical staff begin to refer patients away from you as a doctor, then you know you are really terrible. And that began to happen in Howard Goodman's case. Now you might ask, why didn't they report him to the Medical and Dental Council? Why didn't they do something about it? But you need to also realize that most doctors, their profession is their identity, and to report someone to the Medical and Dental Council for them to lose their license and their identity and their source of livelihood is actually it's not that easy to do. So they kept talking to him, taking him to corners and things like that, but it was getting bad and bad. He once had a patient that had a bimalleolar fracture, and then in the process of repair he put in a screw, and the screw was so long that the screw ulcerated the patient's skin, and the patient came back months after the surgery and showed him what had happened, asking for help because he was in pain. And Dr. Goodman said there was nothing he could do, and there was obviously something he could do. The patient eventually sought a second opinion, and when he went to the other orthopedic surgeon, the guy was flabbergasted that a surgeon, someone of Dr. Goodman's repute, could make such a blunder. And the last straw that broke the camel's back was when Dr. Goodman had a 48-year-old woman, a mother, who came in with pain in the knee and swelling in the knee, tenderness and all that. The woman likely had septic arthritis, so he drained the fluid and gave her antibiotics. She went home. Then she came back days later. The joint had swollen, the pain had increased, she had a fever, and it was obvious that she was getting septic. But because of his busyness, he was in the OR when the patient came, and the assistant called him after the operation and told him that the patient is around with so and so. And he discharged the patient home on oral antibiotics. Obviously, that was terrible. He could have opened that joint, drained the fluid, irrigated that joint, gave her intravenous antibiotics, kept her for a few days before discharging her, if at all. But he didn't do that. The patient went home. Weeks later, she came back. She went to another surgeon. The cartilage were ruined. The joint was so diseased that the only thing that could be done for that patient was to fuse that knee, to have an arthrodesis. And After that, the patient's life is actually significantly affected. She could no longer sit in an airplane. She could no longer walk properly, and the quality of her life was severely affected. And that was what sparked everything. He was subsequently reported suspended, and he had his operating privileges suspended. I think this is a big lesson to everybody. It tells us how far someone can fall. You can be a sterling doctor, and then you can also come as bad as Dr. Howard Goodman. Around the period of his misfortune, however, there was a professional assessment program that was designed for doctors, bankers, lawyers, CEOs, professionals who had great skill but who had problems in their career. And eventually, he was admitted into the facility. It was both a hospital, a therapy center, and had a lot of components of things like that. And it was designed for those surgeons that they are getting old but they don't want to retire, bankers who are making significant mistakes, gambling, people with professionals with several problems like that. So he was admitted and then he was evaluated. And the evaluation from the professional assessment program is that it can make you lose your license permanently. So it was a serious business. And he took it because he noticed, he also saw how bad he was becoming. And then during the process, Dr. Goodman was diagnosed as severely depressed. It was not actually money, because he was making enough money to cater for himself. He had a family, but he was not spending any time with his family. And he was depressed. Mental health challenges can also affect healthcare workers. They can affect doctors. And that is one of the points that Professor Gawande was trying to bring out in his book. Eventually, Dr. Howard Goodman had to retire at the age of 46. I'm tempted to end this video on a cliffhanger. And if you're interested in several other stories, you can actually check out Complication. I'll drop a link to download the PDF copy of the book in the description box below. It's a beautiful book. It's a wonderful book, and it's something young doctors should learn. Most times we learn a lot from mistakes more than we actually learn from successes. And this memoir will help you see things and learn things that you might otherwise never learn in your career. On this channel, I do a little bit of medical lifestyle and a little bit of academics. If you're interested in things like this video, OSCE clackings, examination and things like that, please do subscribe to this channel. Please subscribe. The subscription actually encourages young YouTubers like myself. The last phrase Dr. Howard Goodman said in that chapter was, "I'll be back." And I hope for his sake and the sake of subsequent patients that he will really be back. Thank you very much for watching, and see you in the next video.